Hello, Dr. Chludzinski here at Fanwood Back Relief Center. Today we're going to discuss lower back problems and their causes. For many of us, lower back pain is somewhat of a middle-aged problem. Lots of us sufferers begin to seek chiropractic care in their 30s and 40s and wonder how it all happened. Perhaps it was a sneeze, a long drive, or gardening in the yard that set the pain off. But you were always able to do these things before without so much as a twinge from your lower back. But now things are different. So how come your back seems so weak when it was so strong before? What changed? Not much, actually. The reality is that a back problem begins during our youth. With advances in MRI technology, we can study changes in the discs of the back to see when these injuries first occurred. Spinal degeneration begins to occur at age 10, provided some trauma has occurred, such as from competitive sports or simply goofing around as a child. Rarely is significant pain involved in children and seem to shake it off with an injury for future consequences. But having back pain is not the same as having a back problem, such as a sprain or a disc. When the pain subsides, it does not always mean that symmetrical motion of the joint is restored and that the vertebrae are now back in their normal alignment. Our bodies have a tremendous capacity to heal on their own without any type of doctor helping. But sometimes as recovery and return to full optimal health is incomplete, over time the effects of the gravity and daily stress can cause the joints to become more injured until something as simple as making the bed causes excruciating pain. But was it really making the bed that was a problem? Probably not, since this is something you've done every day of your life. A thorough examination by a doctor of chiropractic prior to the onset of pain could have perhaps discovered one of these silent injuries. But most people wait until the pain happens before seeking help. It's important to be checked after a trauma, even in young children. Properly diagnosing the extent of the injury is the first step to getting you the care you want and need. The pain often goes away quickly, and we often think the problem has also completely healed. Getting regular checkups to make sure that the motions of the spine are fluid and symmetrical is one potential way to avoid bigger problems down the road. Your doctor of chiropractic can also advise you on preventing strategies to minimize the risk of injury, such as proper lifting techniques. This is important information to help avoid lower back injuries. And if you'd like this information, please share it with friends or family. Thanks for listening, and talk to you later. Bye.